us are still cleaning up the mess left behind by Beryl, but don't let that be an excuse to put off health issues. Most of those just get worse with time. If you're experiencing muscle burns, cramps, swelling, discoloration, itchiness, sores, and achy legs, that could mean you have vein disease. At Modern Heart and Vascular, they specialize in diagnosing and treating these vascular issues. Here to help you take the first step toward relief is Dr. Rajiv Agarwal with Modern Heart and Vascular Institute. Good morning.
Good morning, Deborah. How are you doing?
I'm good. All right, let me start with when we say cardiovascular, it's a big, wide range of disciplines, and that's why it's important to go to somebody if you're having vein disease who specializes, not just a cardiologist, but who specializes in that vascular part.
Yes, Deborah, absolutely. Cardiovascular is very encompassing. You've got the heart and you've got the blood vessels. They're like tens of thousands of miles of blood vessels in the body. And when you have a skin condition, you go see a dermatologist. When you have a vascular condition, vein problem, you want to see someone who specializes in that and has a lot of experience.
Yeah, here at Great Day Houston, with our clients, we really appreciate not that they just do great work, but how they treat their clients and their patients. I witnessed that. I have a friend, because of the segments that we were doing, I have a friend who I saw her leg and I went, that is vein disease. You need to see a good vein doctor. And she had talked to somebody before and they kind of said, well, they had talked to her for about 5 minutes. I brought her to you and you spent a half an hour or more with her explaining exactly what vein disease was, what was happening with her leg, and what needed to be done to diagnose further. And I just want to say I was glad to witness that. And you looked at me and you said, I don't just do this because you're sitting here and she's your friend. I do this with all of my patients.
Thank you, Deborah. Thank you for the kind words. And yes, that has to be the standard of care, is you got to take time, you got to communicate with patients and really listen to them. And because half of the battle of diagnosing and fixing things is just listening. And if you listen properly, you examine properly, you diagnose properly, and then you're going to treat properly.
Yeah, and you're testing.
So thank you for saying that.
Yeah, no, and no, thank you for that, because that's just how you do business. Also, how you actually go deeper to look and see where the problems are.
Yes, you have to find the root cause of the problem. We're not here to provide band-aids to anybody, give them diuretics or fluid pills if they have swelling. Let's find out why they're swelling, why they're having the cramps and restless legs and discoloration. Find the root cause, show it to them, not just talk about it, but take the time to show them the ultrasound, show them what normal looks like, show them what theirs looks like, and formulate a game plan that with right expectations, what will work and what will not work. Yeah, it just has to be done the right way.
Yeah, you mentioned dermatologists earlier. I know a lot of people who have those open sores, the itchiness, the purple discoloration, and they'll go to a dermatologist because they think it's a dermatology issue, and the problem, as we know, lies beneath poor circulation. Let's talk about arteries in poor circulation versus veins in poor circulation.
Yeah, arteries are blood vessels that take blood from the heart to the tissues, and veins bring it back. So the symptoms of arterial disease typically is more with exertion. So if you have symptoms in your legs, they feel tired, achy, but with exertion, then it's more likely to be arteries. But if you have the symptoms at rest, at night, just cramps and restless legs, and my mom was not able to sleep for many months, and then she finally told me we fixed her veins. She hasn't had one restless leg, one cramp for 8 years now, Deborah.
Wow.
So you got to find the right diagnosis.
Yeah, what took her so long to tell her son, hey, honey, don't mean to bother you, and got it taken care of? All right, arterial disease risk factors include what?
Yeah, arterial disease, like any other arteries in the body, in the legs as well, would be diabetes, high blood pressure, high cholesterol, smoking. And the newest one that we want to add nowadays is COVID, because people that have had COVID are at increased risk of cardiovascular disease in general.
All right, risk factors for venous disease include?
That's more just sedentary lifestyle, Deborah. People that are not moving much. So secretaries, flight attendants, teachers, doctors, nurses. And it's way more common in women because estrogens also damage the veins and can lead to blood clots and vein disease.
All right. I have a lot of people who will stop me and ask me about the treatment for this. And they say, well, they saw their mother, father, grandparents, whatever, go through vein stripping, which was a huge, a process. We don't do that anymore. That's not what you're doing.
No vein stripping, no surgeries, no cutting. I tell my patients that they're going to drive to our office, get the procedure performed, and then they're going to drive themselves back home. They don't even need a chauffeur to take.
because you have a blockage treatment, almost like a rotor-rooter procedure is what we call that. We're taking a look at the difference that you can make with the legs right there. This is, again, what people might see that's a sign of vein disease when they have like these really pronounced veins like this. And then, of course, after, when you collapse the veins that are causing the problems, then that issue goes away. Dr. Agarwal, oh, you're back with us. Okay. So there's a thing called the VenaSeal treatment.
Yes, that's a treatment that's done in the office. It's glue that we're injecting into the veins to seal off the veins. And the whole point is to make the blood travel from take it away from the bad veins and move it to the good veins. The symptoms are there because the bad veins are getting blood. If you stop the blood from those bad veins and move them to the good veins, the symptoms typically go away. And VenaSeal is one way to do it. It's glue injections with local anesthesia, Deborah.
Yeah, and you have some other options for people depending on what their situation is.
Yeah, the other options may be heat, which is called radiofrequency ablation. And then the last option is something called Varithena, which is foam injection directly into the veins. We go through a thorough game plan with each patient and try to figure out what's in their best interest, what they're allergic to, what's going to work for them, what their lifestyle is, and really formulate an individualized, customized plan for each person that works for them.
Yeah, and speaking of working for them, we have one of your patients who really loved dancing and could not dance because when you have these issues, it really will shut down your quality of life. But after her procedure, there she is in the office. She's like, I am doing the salsa merengue again. I am dancing. And let me wrap up, Dr. Agarwal, with, as I mentioned, is that, you go to somebody who specializes in your part of the cardiovascular world. You all are comprehensive in that. If somebody's dealing with heart disease, you can deal with that person. Somebody dealing with vascular, you have even pediatric cardiology as well. Everyone is kind of under your roof.
Yes, we really are. Hate to make it a commercial, but we really are a one-stop shop for cardiovascular needs, from babies all the way to great grandparents. The oldest patient I have is 107 years old, and she's the most beautiful person in the world.
Oh, wow. Okay, I want to meet her. She's got some stories to tell.
Yes.
Dr.
Yes.
Agarwal, thank you very much.
Thank you, Deborah.
All right, to book an appointment with a board-certified cardiologist at Modern Heart and Vascular Institute, visit them online at modernheartandvascular.com. You can also call 832-644-8930. Again, that number is 832-644-8930. They accept most major insurance, including Medicare. Appointments fill up fast, so contact them today. Modern Heart has locations throughout the greater Houston area, including their newest location in Tomball. And by the way, they have doctors who are fluent in Spanish as well.